Hello everyone, my name is Kimber Grant-Diaz, and today we will be reviewing the teaching method of one-to-one instruction. Now, what is one-on-one instruction? One-on-one instruction is a face-to-face teaching method between a healthcare provider and a single patient. It can be formal or informal. Throughout the day, there are many planned and unplanned interactions between healthcare providers and patients. During these, teachable moments can occur unexpectedly and should always be taken advantage of by the educator. One-on-one instruction is also adapted to meet the needs of the individual learner. Teaching techniques are more easily catered to the patient based on their needs and how they prefer to learn, whether visually, orally, or kinesthetic. Now, there are some major points to keep in mind when utilizing the one-to-one instruction method. The first one is that you want to keep the session short. Sessions should only be between 15 to 20 minutes long. The second is you want to make sure you only provide small, bite-sized amount of material. Focus should be on the quality of new education or information presented rather than the quantity. This allows the patient time to process new material, where lengthy sessions with more information can become overwhelming and the patients are less likely to remember any new information that was given to them. And lastly, this allows you to evaluate the patient learning more quickly and effectively. You can utilize resources like teach back method or tell back method to see if the patient is understanding the new material that have been given to them. You want to make sure you ask questions or give scenarios that allows the patient to utilize what they have learned. Be sure to avoid closed-ended questions or yes or no questions, as it will not demonstrate if the patient is retaining any new information. And with yes or no questions, they're more likely to say yes just to move on to the next section. And it is also very important to keep in mind that you do not want to interrupt the patient and you want to make sure that you give them adequate time to answer. You have to be comfortable waiting in silence because you don't want to try and lead them or try and answer the question for them, as it's an ineffective way for learning for the patient. If you notice that there is some confusion with the patient, you might want to try rephrasing the question, as it may have not been clear enough for them to understand. Now we will look at how one-to-one instruction can be incorporated into the domains of learning. According to Bestable et al., one-to-one teaching can be tailored to meet the objectives in all three domains of learning, since it can be so personalized to each individual patient. Cognitive domain focuses on the development of the learner's intellectual ability. This evaluates their understanding and thinking process of new educational material or information presented to them. Two examples of this could be the first, when giving a patient a new medication, you want to make sure they understand why they're getting this medication and the side effects that they should be aware of when taking this medication. The second example could be explaining the importance of cardiac rehab to a patient who recently just had an MI or heart attack, and allowing them to understand the benefits for them and how modifying their exercise lifestyle can be favorable for them. Now, in the affective domain, it looks at the social and emotional development of the learner. This involves dealing with emotions, expressing feelings, internalization, or commitment to interests, values, and belief. A good example of this, especially with COVID-19 being so prevalent, would be a patient displaying interest in maintaining good hand hygiene and safe social distancing after several one-to-one instructions sessions to help reduce the spread of the COVID-19 virus. Another example could be coping with a new diagnosis, evaluating how that patient is coping with that new diagnosis and how they're internalizing new material about a new diagnosis that they're experiencing. Now, the last domain of learning is the psychomotor domain, and this domain focuses on the patient's acquirement of fine and gross motor abilities and skills. Clearly, this would include like walking, writing, manipulating equipment. Some healthcare providers can teach their patients hands-on how to perform new tasks such as insulin injections or being able to flush a pigtail drain that they're going home with. But another example in the healthcare field could be like a resident learning a new procedure or surgery from a more knowledgeable physician who has been doing it for years. There are pros and cons to every teaching method. On this slide, we'll be looking at some advantages of the one-to-one instruction. First, one-to-one instruction can be tailored to meet the patient's individual needs. This allows more freedom and flexibility for the patient since their education is being directed towards them in the way they like to learn. The pace is also set by the learner. This makes it suitable and ideal for those who have a learning disability and those who have low literacy or educational disadvantages, since they're the ones setting the rate of their own education. As we said before in the previous slide, it can also be taught in all three domains of learning. One-to-one instruction also allows trust to be built between the teacher and learner since it's such an intimate setting between only two people. And because it is one-to-one between only two people, this also allows immediate feedback between the educator and learner. Now, both parties can be engaged in thoughtful learning by being active in the dialogue and learning process. You want this to be a conversation between the healthcare provider and the patient, and not just the healthcare provider giving information the whole time with the patient just listening. And we also touched base on this previously too. It allows the healthcare provider to be able to evaluate the patient's learning more quickly and effectively. Now moving on to some disadvantages to the one-on-one instruction. The first disadvantage is the patient might feel isolated from others who have similar needs or concerns. Because of this isolation, they're not able to bounce ideas off of their peers who are going through similar situations, and it also deprives the patient of the opportunity to identify with those who might have the same issues going on, whether it's the same diagnosis or the same procedure happening. The next one is the learner might feel overwhelmed or anxious if too much information is given in a session. They might feel like they're not able to retain all the information given to them, which is why it's important that we follow those main points of the short sessions and bite-sized amount of material. Also, when we're evaluating their knowledge, questioning them might be interpreted as a test rather than evaluation of their knowledge, which might put more pressure on the patient as well. The patient also might feel like they're on the spot because of the sole focus of the educator's attention, and this also coincides with the next one. Because of that sole focus, they might be nervous or afraid to perform and demonstrate new tasks that they are expected to do at home, like the insulin injections or the draining of a pigtail. We will now touch on examples of one-to-one instruction in healthcare. Our first focus will be on patient teaching. One-to-one instruction is frequently used throughout patient teaching in the healthcare field. Throughout this slideshow, we have already given examples of how to utilize this, from new medication information to insulin injections or learning how to cope with a new diagnosis. But I do want to stress the importance again of seizing the opportunity to teach whenever it presents itself. When patients are asking questions about things that are going on around them, they're showing their willingness to learn at this point. So it's important for healthcare professionals to teach patients in these moments. Our next example of one-to-one instruction in healthcare would be peer-to-peer teaching. Primarily, this shows up in new employee orientation, such as shadowing and precepting. New employees have the opportunity during these times to learn policies and procedures that they'll frequently use on their units through precepting or shadowing a nurse, and they'll also have the opportunity to see the current workflow of the staff on their unit. And then also continuing education. When new policies and procedures are developed, oftentimes it is taught to one single person on their unit who is in charge of going back to their unit and teaching this new policy or procedure to their staff on their unit. And lastly, we'll talk about community teaching. Now, this one is a little more challenging with one-to-one instruction because it can be very labor intensive. This is because the teacher or the educator has to teach every single member of that community. Now, instead of thinking of community as, a town or a city, you can think of a community as a patient's family or their caregivers or the community of that patient, which is more intimate and more manageable. So it's good to teach all members of the patient support team how to help care for this patient, especially if they have like a chronic illness that requires a lot of lifestyle changes as well. So even though it would be a little more labor intensive to be able to teach every family member what they would need to know to help that patient would provide the best support and outcomes for that patient. And then it also could be utilized the same way I had talked about with peer-to-peer with the new policy and procedures. You could teach one person whatever they needed to know, who would be able to then teach the next person and kind of pass it on.